Very good evening to all of you. Today we are going to do pharmacology MCQ challenge. Why is pharmacology important? Because sound knowledge of pharmacology will help you in solving the MCQs of medicine, pediatrics, and pharmacology also. Drug of choice, all these things are very important. So mastering this subject will take you to the next level in your PG entrance exam. So let's begin with the first MCQ. Clinical effect of vitamin D is reduced by A. Simultaneous ingestion of phytate, B. Simultaneous ingestion of lactose, C. Acidic environment, D. None. It is simultaneous ingestion of phytate. Now, what is the main clinical effect of vitamin D? It is to enhance the intestinal absorption of calcium. The average intake of 1000 milligram, what happens only 150 to 250 milligram per day is absorbed. This calcium is absorbed mainly in the duodenum and jejunum, that is proximal intestine, by an active transport mechanism which is regulated by 125 dihydroxy vitamin D, that is calcitriol. Parathermone indirectly promotes the absorption of calcium by increasing the renal synthesis of 125 OH2D3. Dietary lactose, protein, and acidic environment promote calcium absorption. On the other hand, phytate, phosphate, oxalate, tetracycline, alkaline environment impair the calcium absorption. So the correct answer here is A, simultaneous ingestion of phytate. Which of the following is a drawback of extended release preparation? See, extended release drugs are associated with gradual rise in drug plasma concentration that is maintained throughout the day, thus avoiding peaks of high and troughs of low plasma concentration. By delaying drug action, the number of doses required considerably decreases and hence the compliance increases. Though the cost is higher than the normal preparation, extended, so the cost is high. So there is increased cost. Which of the following drug toxicity can be seen in Crigler-Najjar syndrome? See, drugs with established toxicity in case of Crigler-Najjar syndrome are irinotecan and atazanavir. These drugs are metabolized by glucuronidation. So correct answer here is C, atazanavir. An acidic drug is maximally absorbed from A. Stomach, B. Small intestine, C. Large intestine, D. Oral cavity. See, an acidic drug is maximally ionized in the stomach. Okay, but as it has a thick mucosa and small surface area. Now, maximum absorption takes place in the small intestine. So correct answer here is B. Small intestine. Which of the following is the fastest acting receptor? A. Beta 1, B. M2, C. GABA A, D. Estrogen receptor. It is GABA A. Ligand-gated ion channels are the fastest acting receptors. The only ion channel receptor is GABA A. Anandamide is A. Opioid, B. CK1 antagonist, C. D2 blocker, D. Cannabinoid neurotransmitter. Anandamide is a cannabinoid neurotransmitter. It is also known as N-arachidonoethanolamine. Is an endogenous cannabinoid neurotransmitter. The name is taken from Sanskrit word ananda, which means bliss, delight, and amide. It is synthesized from N-arachidonyl phosphatidyl ethanolamine by multiple pathways. It is degraded primarily by fatty acid amide hydrolase Fa enzyme, which converts anandamide into ethanolamine and arachidonic acid. As such, inhibitors of Fa lead to elevated anandamide level and are being pursued for therapeutic use. So the correct answer here is D, cannabinoid neurotransmitter. The drug in the delivery system given below is A, topical use, B, systemic use, both topical and systemic use. Well, it is a transdermal patch and it is systemic use. So the correct answer here is B, systemic use. Which of the following drug is preferable in WHO stage 4 of this condition? Well, from this X-ray, it is very clear it is pulmonary arterial hypertension. So the correct answer here is epoprostenol. Acidic drugs bind to. Now, acidic drugs bind to albumin. Acidic drugs are best absorbed in the stomach. Basic drugs are best absorbed in the intestine. Acid drug is ionized in the intestine. Acid drug excreted quickly in alkaline urine. So the correct answer is C, albumin. The drug in the picture is used for, well, it is pill 72. It is an emergency contraceptive. Two tablets of levonorgestrel given in the picture are used. It is used for emergency contraception. Sugammadex is used for A. Organophosphate poisoning, B. Reversal of neuromuscular blocker, C. Treatment of local anesthetic poisoning, treatment of central anticomic syndrome. It is reversal of neuromuscular blocker. Mode of excretion of cyclophosphamide is A. Lung, B. Liver, C. Kidney, D. Skin. It is kidney. Go to the description. Will Ultimate NEET PG Breakthrough Blueprint Revision Masterclass, which covers all the 19 subjects in the holistic manner. It is useful for both those who are preparing for this NEET PG and also the future NEET PGs and the next exam also. And will be also be useful for INICT also. So just click the link in the description. The first 10 people who click the link in the description will get this masterclass absolutely free. What is the type of receptor given in the picture? A. GPCR, B. Ion channel receptor, C. Enzyme link receptor, D. Nuclear receptor. It is ion channel receptor. Duration of action depends on A. Clearance, B. Rate of elimination, C. Bioavailability, D. All. It is all. Which of the following drug can cause thyroid dysfunction? A. Amiodarone, B. Ampicillin, C. Ibutylate, D. Acyclovir. It is amiodarone. Now, what are the drugs causing hypothyroidism? Lithium, sulfonamide, phenobarbital, phenytoin, amiodarone, rifampicin, carbamazepine. Which of the following anti-migraine drug might have caused a side effect in picture? Sumatriptan, propranolol, methotrexate, ergotamine. It is ergotamine. Dopamine, all of the following is true. Causes increase in GI ischemia, positive inotropy, improves renal perfusion, causes vasoconstriction. Except causes increase in GI ischemia. The side effect of digitalis are all ventricular tachycardia, vasodilatation, nausea, vomiting, ventricular bigamy. Well, it is vasodilatation. Digitalis, in fact, causes mild vasoconstriction, not vasodilatation. Antiandrogen used in heart failure is carvedilol, sampretlat, spironolactone, abiraterone. It is spironolactone. Which of the following drugs might have caused the side effect given in the picture? Antacid, bismuth, cisapride, sucralfate. It is bismuth. Gemcitabine is used mainly in which cancer? Colorectal, breast, pancreatic. Maximum liver toxicity is seen with which anti-TB drug? Isoniazid, rifampicin, pyrazinamide, streptomycin. It is pyrazinamide. Fastest acting antithyroid drug is iodide of NaK, propylthiouracil, methylmethazole nitrate. Iodide of NaK. Natalizumab is used in treatment of A. Multiple sclerosis, breast carcinoma, psoriasis, B-cell lymphoma, multiple sclerosis. Special feature of Glargine insulin produces smooth peakless effect, not suitable for once daily administration. It produces smooth peakless effect. Mechanism of action of trilostane is 11 beta hydroxylase inhibitor, 1 alpha hydroxylase inhibitor, 3 beta hydroxysteroid inhibitor, 7 this 3 beta hydroxysteroid inhibitor. Treatment of choice for cheese reaction is prazosin, pentazocine, phentolamine, phenoxybenzoate. It is phentolamine. Essential drugs. Yeah, included in national pharmacopoeia should always be present at PSC. Those that satisfy the primary healthcare needs of population life-saving medication. Those that satisfy the primary healthcare needs. Post-marketing surveillance include which phase of clinical triangle? It is 4. Which of the following is most active against slowly dividing tubercle bacilli? Isoniazid, rifampicin, streptomycin, ethambutol, rifampicin. Drug contraindicated G6PD is chloroquine, primaquine, quinine, all. It is all. Now, which of the following anti-cancer drugs are competitive inhibitor of tyrosine kinase? Imatinib, sunitinib, letrozole, bicultamide, fulvestrant. It is uh, imatinib and sunitinib. Which of the following drug might have cause? It is lipohypertrophy. It is due to insulin. C. Ranibizumab is monoclonal antibody active against IL-6. CD20 VEGF, EGF, that is VEGF.